CPR, cardiopulmonary resuscitation. We've all seen it, right? Well, at least we've seen the Hollywood version of it dozens of times. In the movies or on TV, it seems like a miracle that is nearly guaranteed to work wonders, bringing virtually anyone back from the brink of eternity just before the next commercial break. But is the picture that Hollywood paints accurate? How often does CPR work in real life? What are the potential benefits and harms of CPR? And is there ever a circumstance where it may be better to choose not to perform CPR on a patient? This video will answer these questions and help you to be more informed about decisions regarding CPR that you might need to make for yourself or a loved one. Modern medicine is truly amazing. As a society, we have come to expect miracles from doctors and hospitals, and indeed in many cases, incredibly good outcomes occur on a daily basis as life is extended further and further. But even with our skill and knowledge, there is still a limit to what medicine can achieve. Despite everyone's best efforts, death is still a part of life, and it is still possible to face that eventuality with dignity and respect. So how does CPR fit into this picture? First developed in the 1960s, surgeons and anesthesiologists used CPR on patients who experienced heart stoppage in the operating room. And in these situations, CPR continues to be very effective, resuscitating 70 to 90% of operating room patients. CPR was also found to be successful in previously healthy patients who experience heart stoppage, or what is called cardiac arrest as a result of an unexpected emergency, such as a heart attack, drowning, an allergic reaction to medication, accidental electrocution, suffocation, choking with airway blockage, or as a complication of a heart catheterization. In these previously healthy patients, CPR can be successful up to 50% of the time in restoring the heart rhythm and saving the patient's life. Over the years, however, CPR began to be used on patients for whom it was not intended. Rather than being used on previously healthy patients with a sudden change in their condition, now CPR is being used on patients with long-standing and deteriorating medical problems, such as cancer, heart failure, and lung disease. In these patients, CPR success rates are not nearly so good. Medical studies indicate that only 30 to 40% of patients are successfully resuscitated by the procedure, and only 15% of patients survive to hospital discharge. And if a patient suffers from strokes, multiple organ failure, severe kidney, heart or lung disease, or lives in a nursing home, the statistics are even worse, dropping to between a 1 and 5% chance of survival following CPR. You might think, why not try for the 1% chance? Unfortunately, there are serious complications from CPR. Of the patients who survive, 1/3 have broken ribs, many have bruised lungs, and 10% or more of the survivors have brain damage, leaving many of these patients in a vegetative state. It's not exactly the Hollywood storyline that we all hope for, and it may come as a surprise. Usually on television, CPR is performed on younger patients who have had heart stoppage from trauma or a drug overdose. In real life, CPR tends to be performed in hospitals on older patients with severe medical problems. And usually these stories don't have Hollywood endings because most of the time CPR simply does not work. Unfortunately, life isn't always as easy as the movies make it seem. On those TV shows, the hero has the benefit of the director calling cut at the end of the scene. In real life, there is no such relief, and we have to face the tougher choices. And one of those choices may be to choose not to perform CPR. Doctors face these kinds of decisions daily. As part of their training in medical ethics, doctors, nurses, respiratory therapists, and emergency medical services personnel are educated on the options they will face in these times of crisis. Healthcare professionals learn that just because CPR can be done does not mean that it should be. Doctors are bound by their professional oath to be of benefit and do no harm. When they determine that CPR is unlikely to benefit the patient, but will cause pain and suffering as a result of broken ribs and contused lungs, doctors recommend that CPR not be performed. In fact, the 2005 CPR guidelines from the American Heart Association state a careful evaluation of the patient's prognosis for both length and quality of life will determine whether CPR is appropriate. CPR is inappropriate when survival is not expected. The New England Journal of Medicine stated, "In cases in which CPR has been shown to be of no benefit, as in patients with metastatic cancer, it should not be considered an alternative and should not be presented as such." CPR is a desperate technique that works relatively infrequently, and in many types of patients virtually never. To solve the ethical dilemmas posed by CPR, we must first face that medical fact. As a patient or a family member, you may not have medical journals to consult, but you have the authority to make these decisions, so it is important that you become educated now on the steps to ensure that your wishes are carried out when the time comes. So what are some practical steps you can take right now? One of the first steps is to get more information, and a great place to start is this website, www.wvendoflife.org. Here you will find resources that will educate you further about the realities of CPR and other treatments. Knowledge is very empowering when facing these difficult times in life, and this website will assist you to make informed decisions for yourself or your loved one. Another step is to talk to your doctor and family. Are there any circumstances where you would prefer for CPR not to be performed? It is important to discuss these circumstances and make your wishes known. Death does not have to be a violent fight to the end. It can be a dignified, peaceful passage. If this is your wish for yourself or a loved one, talk to your family doctor. Your doctor will help you take the necessary steps to ensure these wishes are followed. These steps involve completion of legally binding forms. These include a DNR form and a post form. You may not have heard of these forms before. The DNR, or Do Not Resuscitate form, is very common. Whenever a death has occurred in the hospital, 80 to 90% of the time it occurred after a DNR order was written. Many people reassure themselves and their families with the knowledge that they will not endure a prolonged time on a breathing machine lingering past the point of recovery. The post form, or physician order sheet, is similar to a DNR form, but covers more things. Beyond CPR, it includes feeding tubes, IV nutrition, breathing machines, ICU, and other medical treatments. This form is an extremely effective and useful tool for preserving dignity in the dying process. Information about these forms can be found on this website, www.wvendoflife.org, or ask your family doctor. They can assist you in obtaining the correct documents. It is important that you and your doctor use these forms to make sure that your desires are clearly documented. Take this active step. Do not delay. And if you are considering these options for a family member, remember, families of unconscious patients frequently make the decision for their loved ones not to be resuscitated. They do so because they do not want to see their loved one harmed. And unfortunately, not only can CPR cause damage to the ribs and lungs, but if the patient lives through CPR, he or she faces having a tube placed in the throat, being connected to a breathing machine, and being treated in an intensive care unit. And for most patients who survive the initial resuscitation attempt, they linger on a breathing machine until their heart stops again. Unfortunately, life is not like the movies, and modern medicine does have its limits. However, armed with the proper knowledge, it is still possible to have an ending that is dignified. And while it is a time for mourning, it is also a chance to honor the life that was lived. We hope this video has contained useful information. For additional resources on this subject, ask your doctor or contact the West Virginia Center for End-of-Life Care. Call 877-209-8086 or go to the website www.wvendoflife.org.